Hi, my name is Dr. Rudra Mohan through the Oral Health channel. Today we're going to be talking about informed consent. Let's start. So today I'm going to be talking about informed consent, which is usually considered by patients and dentists as just a documentation of the procedures that have been done. So this document basically, which is signed, is usually not given much of attention by neither the dentist nor the patients. The dentists usually take it as a legal protective document so that we can defend it somehow if anything goes untowardly in the patient's progress or the treatment outcome, and that's why we can say in if there is any sort of litigation that we have taken informed consent, and the patients think that this is just a part of the documentation process. But let me tell you that informed consent is not just a document. There is another thing which is known as an informed consult or informed consultation process. Now what happens is that if you come to our clinic and you tell us what your problem is, we do the examinations, we take the x-rays, and we do all sort of tests with your permission, and just after that, when we arrive at the diagnosis, we have a multitude of options thanks to the advancement of dentistry. And if your doctor is assertively telling you that this is the only option that is feasible for you, that's not the right thing. So our main thing is that the first thing that we have to tell you is to tell you what is the problem, what is causing the problem, and what all treatments do we have, what is the goal of our treatment, what are the benefits of the treatment, what are the risks, and what are the potential complications, and what are the financial commercials of the treatment. Now the whole point of the informed consultation process is to not just protect ourselves for the legal litigation, but also to give you autonomy, to make sure that we reach at a similar level of knowledge, obviously because of the fact that we have been educated in dentistry, and you are obviously thankfully placing our your esteemed faith in us. Most of the times you don't feel like reading the informed consent form, but I really request you, if you can really go through the consent form, it will give you more ideas and more queries about the treatment that we are planning to do. Now the informed consent actually has three phases you have to understand. The first phase is basically where we give you a choice of you want to get the treatment or not. So we will come with the diagnosis and we'll tell you this is what the problem is, do you want to get the treatment? Once we have that in our court, we will give you the choice talk, that is that these are your choices and alternatives of treatment depending upon which treatment would suit you the best in terms of dentistry, in terms of healthcare, in terms of restoring your problem. At the same time, making sure that other factors such as systemic health factors or any sort of complications, risks, or financial problems or financial constraints because of the fact that a high value treatment might not be very feasible for you because of whatever obvious reasons. We will come down to a very educated and calculative decision together by educating you about the different types of choices to be made in the decision making process, and we will enable you to make the shared decision making process. Now after this, that you've made the decision, then you will give us the decision talk. That means I am ready for this treatment option and I am ready to go for it. So I'll have to be very honest, most of the people, the dentists, think that this is more of a litigation protective mechanism, the informed consent. But let me tell you something, I've gone through the literature. Most of the negligent or malpractice suits are not about the fact that they were not informed consents or any sort of negligence on the part of omitting information, but it was more about devaluing the patient, neglecting the patient after the treatment was done, and things like which were basically centered around ineffective communication. Now I understand that omitting information is something of a big thing, that is ineffective communication, but then again you have to understand that as a dentist it is very important for you to go through the informed consent and the consulting process so that as a patient you can make an informed decision thinking about all the variable parameters, because once I get to know about your life, I will get a better idea of what all treatment options would be fine for you. Suddenly for some exigency event that you have had some big financial loss, I can't force or assert that sort of heavy dental treatment or expensive dental treatment. So we'll have to chalk out some options which are feasible for us. Also sometimes I have a specialized practice, so sometimes I might not be, whatever I'm trying to do, whatever is the right treatment for you, the correct treatment for you, is something that is out of bounds for me as a periodontist. So I will have to call in a specialist, or maybe I might have to refer to you. I understand that the whole point that I might be kind of cutting out of my business, but I want you to get the right treatment and the correct treatment, even if it's sometimes me holding back on my own financial and monetary gains or clinical gains, because of the fact that we want you to get better and have better overall health and oral health as possible. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Please try and refrain from calling me directly. Here are my social media handles and my WhatsApp number. Drop me with your name, your place, and the common oral health problem that's causing you discomfort, and we will have a discussion in a couple of days over message about it, and we can come to a conclusion. If you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.